Hey everyone, welcome to our deep dive. We're going to be talking about an interesting topic today called transient ischemic attacks, or also known as TIAs. I'm Ashley.
And I'm Tanya. We're not presenting live in front of a class, which is honestly a relief, but we're really glad we get to share this in a more relaxed way. Podcast.
Yeah, I agree. TIAs are something you might hear about, but not really understand. They're sometimes called mini strokes, but that can give the wrong impression.
Yes, exactly. So what exactly are they? What is TIA? They're short-lived, but they can be the body's way of shouting, hey, a major stroke might be around the corner.
Yes. So today, we're going to break that all down. What a TIA is, who's at risk, how to prevent them, and a real case example that will make it all more real.
Yes, exactly. So, we gotta provide that good information, and then we'll talk about what we would do as nurses in that situation. So, what is a TIA? So, let's start with the basics. A TIA is when there's a temporary blockage of blood flow to part of your brain, spinal cord, or retina.
Yeah, so the key word there is temporary. Unlike a stroke, the blockage clears up before it causes any permanent brain damage.
Yes, so symptoms can last a few minutes or maybe a couple of hours, but the key point is it's always less than 24 hours, and once the blockage clears, everything goes back to normal, at least on the surface.
Yeah, that's the tricky part though. People think that they're fine just because the symptoms go away. But it's not always a free pass. It's more of a warning sign.
Yes, right. So think of it like your check engine light turning on in your car. You wouldn't ignore that and just keep driving, or at least you shouldn't, right?
Yeah, unless you want to end up on the side of the road, which I know I don't want to.
Of course, me neither. Who would want that, right? Especially, in this world
But
we live in.
in this case, in the ER or something worse. So, now we're going to be talking about risk factors. So, who's at risk for having a TIA? Honestly, the list looks a lot like the risk factors for stroke and heart disease.
Yes, so I'm going to provide a couple examples such as high blood pressure, diabetes, high cholesterol, atrial fibrillation, smoking, a sedentary lifestyle, obesity, and carotid artery disease.
Oh, and don't forget family history too. Some of these, like age and genetics, we just can't change.
But the good news is a lot of them we can work on, also known as modifiable risk factors, such as quitting smoking, improving diet, and of course the most important, I would say too, that also helps with stress would be physical activity and keeping your blood pressure under control.
I agree. And this is where nursing comes in. We're not just treating people after the fact, but we're helping them change habits to lower the risk.
Yes, I think that's one of the most rewarding parts of nursing, seeing a patient take those steps and knowing you help them get there.
That is very rewarding.
Yes, indeed. So now we're going to be moving into preventative care. So prevention is really about controlling the risk you can do something about. So that means a healthy diet. So you might ask, what does that specifically mean? So think about more fruits, vegetables, lean proteins, and less processed food.
Yeah, you know what that also means? It also means more regular exercise. And I don't mean running marathons. We don't have to run long distances. Even walking of 30 minutes a day can make a difference.
Yes, it does. And then there's the quitting. Well, there's quitting smoking and maintaining a healthy weight. All of these lower the chances of having another TIA or a stroke.
Yeah. And for some patients, prevention also includes medication.
What are some of these medications?
Antiplatelets or anticoagulants.
And what specifically do they help with?
Yeah, I knew you were going to ask why. So they help prevent clots from forming.
But I do want to add to that they only work if you take them consistently, of course. We I also want to educate patients that they shouldn't skip doses, because it's just like locking your door but leaving the window wide open. You're still at risk, right?
Yeah, exactly. So, our role is to make sure patients understand why these changes matter, not just telling them what to do.
Of course. Very good point you make.
And as
Ashley.
we know, patients will be more motivated to heal when they have a great part in their treatment plan.
Yes.
All right, so now we're going to move on to the case study summary. We're going to give you guys a real life scenario so you guys can relate to this more.
And have a better understanding and what we have to know in order to cope with it in a real life scenario.
Okay, should we jump in?
Yeah, let's take a deep dive in.
All right, let's bring this to life with Mrs. G, the patient in our case study. So she came into the ER alert and oriented, but she had numbness on the right side of her face and arm.
Wow. So I also want to add into what you just said, Ashley, that she also had a slight facial droop and weaker grip in her right arm when we were doing her assessment. But her speech was clear and she didn't have vision problems.
You're right. Her blood pressure was a little high, 148/97. But other than that, she was pretty stable.
Wow.
Her heart rhythm was normal. Her labs were fine, except for a slight increase in high sodium. But her CT and MRI were both normal.
So you may ask what happened after that. So they started her on IV heparin and admitted her for some tests. Some of them were some labs, and they were like the MRA, the cholesterol check, and they also continue to monitor her BP, her blood pressure, because you did say it was a little high, right, Ashley?
Yes, it was. And here's the classic TIA thing. By the time that she was admitted into the hospital, her symptoms were completely gone.
Wow. See, that's what makes TIA so tricky. The danger isn't always in the moment, So it's in what could happen next,
I agree.
And that's very important because some patients might have all these symptoms and they say, oh, they all went away. Why go to the ER, right?
I feel better, but actually that's very scary.
Yes, and that's why very, very scary.
All right, so now we're going to move on to case study questions. So we're going to go ahead and read the case study questions, answer the questions, and then conversate about them.
Okay, so we're going to start off with patient question. How is what I have different from a stroke? So, the lady came in and she had this question. So what would the nurse say?
So a TIA is different from a stroke because the symptoms are temporary and cause no lasting brain damage. In a stroke, the blood flow blockage is prolonged, enough to cause permanent injury to brain tissue, leading to long-term neurological deficits, like left-sided weakness, the facial droop.
Okay, so what are some characteristics of TIA?
A couple of characteristics of TIA are sudden onset of focal neurological symptoms, such as weakness, numbness, vision changes, or difficulty speaking. And then symptoms that resolve completely within 24 hours, or often within minutes. And then another characteristic is no evidence of acute infarction on brain imaging.
Wow, that's very scary, especially, trying to help these patients with what they have, and doing some scans or some imaging wouldn't even help. So how do we explain the difference between a TIA and stroke to patients? The simplest way is that a stroke causes permanent brain damage. A TIA doesn't.
Yeah, and in a stroke, the blood flow is blocked long enough to kill brain cells. In a TIA, it's temporary and there's no lasting injury. But the risk for a full stroke after is very high.
Wow, Ashley, thanks for pointing that out. And that's why it's so important to treat a transmedic ischemic stroke like an emergency. Just because the MRI is clear doesn't mean you're out of danger, right?
Nope, not at all. All right, so we're going to move on to the next couple of questions. So, how Mrs. G fits the typical TIA patient profile.
So, Mrs. G has a sudden temporary neurological symptoms that resolve within a short time frame and had multiple vascular risk factors, placing her in a high-risk category for transemic ischemic attacks.
That is very typical for TIAs. Now, Mrs. G's predisposing risk factors for TIA and possible stroke.
Yes.
What are they?
Hyperlipidemia, which is very high cholesterol, possible atrial fibrillation or other cardiac arrhythmias, family history of stroke, and also sedentary lifestyle or smoking.
So yeah, Mrs. G had several risk factors. Like you mentioned, high cholesterol, possible heart rhythm problems, maybe a sedentary lifestyle, and the possibility of smoking.
So, see, that's the important thing, to look at modifiable and non-modifiable things. So, some modifiable things could be she could work on some of these like diet, exercise, and smoking cessation.
Yeah, but she couldn't change her age or her family history. That's where targeted prevention comes in. You can't fix everything, but you can still make a big difference.
Yeah, interesting.
All right, so we're going to be moving on to our next couple of questions.
Which of her risk factors can she change and which are beyond her control?
So, as we have mentioned a little bit previously, some modifiable risk factors are smoking, physical inactivity, poor diet, uncontrolled hypertension, elevated cholesterol levels, poorly managed diabetes.
Non-modifiable would be age, like you mentioned, family history, and previous TIA events.
And then some nursing monitoring while on IV heparin.
See, while she was on the heparin drip, our number one priority was monitoring for bleeding, such as bruising, nosebleeds, bleeding gums, or even blood in the urine or stool, which is why, we also have to talk consistently with our CNA, to make sure they're alert on, hey, what to notify me on, right?
Any new bruises, unexplainable nosebleeds, anything like that should be monitored. I agree.
These are very, very important in order, to help the patient and act as soon as possible.
I agree. Also, neurological status for signs of intracranial hemorrhage, like sudden headaches, confusion, or weakness. We want to catch neural status closely for any sudden symptoms because this can be an early sign of internal bleeding, and that could help us prevent further complications
and damage, of course. And then there's labs. Of course, we have to monitor, especially on heparin, so checking her APTT to make sure she's in the therapeutic range and not at a too high or risk of bleeding, of course.
Yeah, I agree. Okay, so moving on to our last couple of questions. Major complication associated with TIA. What is that?
So thanks for asking. So the most serious complication is the development of a future ischemic stroke, often within days to months after the transemic ischemic attack.
Wow, days and months? I thought that it would happen immediately after.
No.
Okay, so could you provide me with 4 nursing diagnoses in order of priority for a patient with TIA?
So the first thing is we've learned in MedSurg our neuro checks. So risk for decreased cerebral tissue, perfusion related to transient interruption of blood flow. So that's important. Priority. Number 2, risk for injury related to potential neurological deficits. Very important as well. And then deficiency knowledge related to risk factor modification and medication regimen, of course.
Okay.
And number 4, anxiety related to fear of recurring TIA or stroke.
Yeah, I completely agree with you. The number 1 complication after a TIA is definitely an ischemic stroke. And like you mentioned, it could happen within days or months, which came as a surprise to me.
So for nursing diagnosis, we'd include risk for decreased cerebral tissue perfusion, risk for injury, deficient knowledge about risk factors and meds, and anxiety about recurrence, of course.
I agree. Addressing those right away helps prevent bigger problems and reassures the patient.
And that's exactly what we want to provide. We want to provide a good, patient care, and we want to make
proper
them feel
education,
very safe. Making sure they know that we understand them, and we're trying to provide the best care with the whole team working together in
interdisciplinary team.
Yes, the interdisciplinary team working together to create a personalized care plan, right?
Yeah, and then it's very important for the patient to understand the symptoms and know when they should go to the doctor.
I also want to add to that, not only should the patient know, I think also including the family is very important in the care for the patient, of course. Right. Do you agree with me on that?
I do. Sometimes patients live with family members, and they should also know the proper education to care for this patient in case of any emergencies.
Yes, so we also use the acronym Be Fast in order to notice these things as well, right?
Yes. So now we're going to go ahead and talk about any knowledge that should be taken into the personal nursing practice, or in other words, nursing takeaways.
Of course. Understanding that TIAs are reversible but signal a high stroke risk has strengthened our focus on timely assessment, patient education and prevention, watching for even subtle neurological changes, teach patients how to manage, of course, like we just explained, and modifiable risk, and closely monitor those on anticoagulants like heparin for bleeding, and then also working with the healthcare team to adjust care as needed. This knowledge helps provide safer, proactive, and patient-centered care.
Wow.
Which
You've
is
mentioned
very important.
Everything that we have talked about.
Yes, and that's one takeaway that I've learned in fundamentals,
Yeah. Everything plays a huge role.
Yes.
Yeah. So if there's one thing I've learned from this, it's that reversible doesn't mean harmless. A TIA is your warning shot.
Yeah, it's your body's way of saying you need to act now. As nurses, we're there to recognize the signs, educate the patient, and make prevention plans.
And to anyone listening, or just the professor, if you or someone has sudden neurological symptoms, even if they disappear,
what should we do?
Call 911.
Don't wait to see if it happens again.
No. Well,
exactly. Well, that's our TIA talk. Thanks for listening, and hopefully this gave you a better understanding of why fast action and prevention care matter so much.
And if you know or experience someone having a TIA attack, make sure that you let them know to go to the doctor. Don't ignore it. Just because the symptoms are gone doesn't mean that there's no stroke coming.
Yes. Well, thank you so much, Ashley.
All right. So thank you guys for watching. Here are a couple of the references that we used for this presentation. And that is it. That was a great podcast.
That was amazing. Thank you.
I really enjoyed this podcast, and I feel like I've learned so much.
Yes, very. We did take away some key points. Like we learned a lot and have a better understanding of real life scenarios with Mrs. G.
Yep. And that brings us to the end of our podcast. Thank you so much for listening.